Welcome to another episode of Dr. Simone Says. My name is Simone Eastman Yuan. I am a medical doctor with sickle cell disorder. I am also the best-selling author of the books All Rise, The Sickle Cell Community versus the Medical Establishment, and A Doctor in a Patient's Body, Dreaming Big with Sickle Cell Disease and Chronic Pain. These days, I like to spend my time making sure that every sickle cell survivor becomes a sickle cell thriver because it matters that we live well.
Hey guys, it's me, Simone, and thought I'd say a quick hello. And normally I don't videotape any of my hospitalizations, but in light of the fact that I'm trying to turn a new leaf and have less of me and more of the focus be on the issue of sickle cell disease and what it is that happens when we go through a crisis, I decided to do exactly that and just show you. So I am right now waiting for a bed and a chest CT. I am also, I think I went to, whenever I'm exposed to a lot of people, whether it be church or any place else, I have to be very careful because I can get an infection very quickly. I am immune compromised because I'm constantly on steroids. I mean, never-endingly on steroids because I had a situation back in, I think, 2003 where I sickled in my adrenals, and so I don't produce my own steroids anymore. And we actually need steroids, believe it or not, in our bodies to make our hormones. And so if you don't have steroids on board, there's a problem. So I now have to take exogenous steroids, so meaning that they're prescribed. Of course, steroids have side effects, and so I have to deal with those too. But anyway, one of those side effects is that it causes immune suppression. So I can get sick very easily because my immune system is compromised. And for some reason in my head, I like to think that I don't have to put on a mask if I'm going to church. I'm not quite sure why. So I am learning the hard way that I do have to put on a mask to protect myself. I think most times when people see you on with you having a mask, they think that you're sick, and so you're trying not to spread the germs to anyone. And I think I have fallen victim to that perception and thinking, I don't want anyone to think that I'm sick. So I'm not going to wear a mask. But then I don't protect my own self, and then I come home and I inevitably will get sick. The other thing that I have to consider is that I constantly have people over in social settings in my home, and probably during the winter is not the best time because everybody has a bug. Everybody has the flu or cold or something like that, or they're carriers, so they may not have it themselves, but they may work in an environment where people are constantly sick, and so they can be carriers and not realize it, and then I end up getting sick because my immune system is vulnerable. So I'm having to learn or be reminded and finally learn the hard way to protect myself. I tend to be very social, so it's very hard to think of isolating myself in any way from people. But it looks like I'm going to have to do that, especially during the winter months. So anyway, other than that, I am waiting for blood work to be returned. They started my IV. I think you can see that in the back, and probably once the blood work is back, they're gonna be able to start the antibiotics because they'll be able to see what the bug is sensitive to and go from there. So yeah, that's about it. Please say a prayer for me, and I will talk with you guys soon. Take good care. Bye-bye. Hi, everybody. It's me again, and I just wanted to do a follow-up and let you guys know that I'm feeling much better today. So yes, I did get admitted overnight. Rip roaring infection, and so they had to start broad spectrum antibiotics because they didn't know what to kill the bug with. So now I'm waiting for the sensitivities to be able to have them figure out what to send me home with, what antibiotic to send me home with, and it is slow in coming back. It's so annoying, actually. Someone recently brought up the concern about getting admitted over the weekend and all that it entails because everything is so slow. And we pay the same, our insurance pays the same, but we get less out of that weekend stay. So I always hate when I am sick and having to come in on a Thursday or Friday, because I know if I have to stay more than a day, that it's very likely that you can go into a weekend and not get anything done. I am hoping to go home tomorrow. I didn't want to be here in the first place, but I'm hoping to be able to go home tomorrow. Let's see. Also got a CT with some contrast, which tends to ramp up my system and could trigger an even worse crisis. So right now we have me on some aggressive IV hydration to flush that out of my system. And I'll do my own thing when I go home to further get it out of my system as far as oral chelations and things like that. Pain management. So I left that for last because that was something that was really interesting. I came and found out that the hospital actually ran out of Dilaudid, which is a very strong narcotic. It's like 10 times the strength of morphine, I think. Then anyway, it's used for most patients with sickle cell to get the pain under some level of control. And they don't have it. Now, I'm being told all kinds of reasons why, and I actually heard someone else about a week ago Facebook live stream and said that she was having a hard time getting that medication and was waiting a rather long time in pain. She's not from Florida, and I remember being on the live stream with her until she could actually get some help, walking her through who to talk to, calling, patient relations, because it was during the, time that she could do that. And I think they heard her talking to someone in her phone, not sure if she was maybe getting legal advice, and kind of jumped to it and got some medicine for her. I'm not sure what they ended up getting, but it seems like there is a legitimate shortage of this medication. So when you get to the hospital thinking that you're gonna be able to get your pain under control, there's nothing there. But it was such an interesting thing to have that conversation with my hematology team. And even though I'm lying here with no makeup and my hair all over the place, they were standing around my bed and talking, and we were brainstorming of what to put in its place. And, people were like jotting down things of agencies to call and things like that. And, in the end I said, listen, my antibiotic is kicking in, and when my infection gets under control, it is very likely that my pain will too. but I'm doing this because there's another sickle cell person that's going to come after me that won't have bargaining rights, that won't be able to advocate for themselves, and I want them to be able to have what they need when they do get here. And they looked a bit surprised. I think they were, trying to backflip thinking that I needed it. But it's just as if it were for me, if they could work that out and get it for the next person that gets here. And it makes it very obvious to me after having the talk, like sometimes why I'm placed in the positions that I'm placed in. It's not that I want to be here. I don't like it. I want to be home in my plush sheets, but I can't have that conversation at home. I can't help anybody at home. And so sometimes it is going to be literally feeling like my death so that somebody else could live. But I really appreciate the opportunity to be able to do that, because the other people are not going to be able to advocate in that way. They won't be a doctor and in a patient's body. They will just be a patient. And so I, even while I was sick, could get a chance to advocate for them. And something about that made me feel good in my heart today, even with my hair disheveled and even with, flat on my back, just being able to talk sensibly to a team of doctors that force them to think outside of the box for us, so that the next person that does come for their treatment will get it. Anyway, I hope this makes sense to you guys. I forgot to explain also that the square thing you saw on my chest last night, this is actually a Metaport, and some of you can probably Google what Metaport is, but it's surgically implanted when somebody doesn't have enough vein access after having multiple blood transfusions and everything else. My veins kind of decided to hide out, so I don't have those access. So we had to actually surgically go in and put a port that sits by my right heart chamber and gets all the blood a body can want. And I can also get transfusions through it as well. I'm hearing my my IV beeping, so I think that's my cue to go. And I'll keep you posted, but pray for me that I can get out tomorrow. All right, you guys. Love you. Talk to you soon. Bye-bye.
Hi guys, it's me, Simone Yuan, and I am just touching base with you to let you guys know that I am heading home. So you have basically helped me through an admission, a stay, and a discharge. And so just wanted to show you, what it's like. I am going home in pain, but that is often the case with sickle cell disease, because you can never get, it's very difficult to get 100% control, and especially with the pain medications not available that were ideal to treat me. But like a house that's been on fire, when you put out the fire, the house can't be lived in right away. So I'm going to go home and I'm going to rebuild my house, and it will probably take a few days. So don't expect me to be jumping back into activity with my burnt house, is what I'm trying to say. I will probably be recuperating and trying to get back to what I know to be baseline. There's also a cold front coming up in a couple of days, so I'm not looking forward to that. So please say a prayer for me for that as well. But I have been treated for my infection, and so I'm in the clear, and I am going to be wearing a mask when I go out, things like that. So at least for the winter. And the staff was completely supportive, so I'm really grateful for that. And
because of the nature of my health, actually one of the doctors offered to direct admit me for my future sickle cell crises so that I don't have to wait in the ER, because that would put me at further risk because I'm immune compromised as well. It would put me at further risk in terms of, breathing in everybody else's germs when I am on steroids and immune suppressed. So I'm very grateful for that, and made some other really cool contacts as far as advancing sickle cell advocacy. So I'm going to be following up with that when I am better. But first things first, I'm going to go home and I am going to get a nice shower and head to bed and rest and rebuild my house. So, but thank you guys for all of your support and all of your prayers. I really, you guys don't know how much that carries me, just knowing that people are praying. I feel like I live because you pray, and so I'm grateful for you. All right, take care, and I am off to home. I'm going home. All right, thanks. I'll talk to you guys soon. Bye-bye.
Until next time, this is Dr. Simone Says, and remember, you are a sickle cell thriver and not just a survivor. If you benefited from this episode any at all, please like on the video, subscribe to the channel, and share the video with one other person as your good deed towards the sickle cell cause. Have a great day. If you would like to contact me to speak in your area, please don't hesitate to email me at drSimoneSays@gmail.com. If you are the one referring me, please let me know so that I could send you a nice thank you surprise.